This is a short review on the information on diet. Calcium is part of hydroxyapatite. It's embedded in collagen and provides strength and rigidity to bone. Factors that influence calcium absorption include growth hormones, lactose, vitamin D, and stomach acid. Factors that inhibit calcium absorption include stomach acidity, low vitamin D levels, phytates, and oxalates. In addition to dairy, cruciferous vegetables are a good source of calcium and have a higher bioavailability. Remember that milk consumption does not correlate with lower fracture risks worldwide. Hydroxyapatite is also composed of phosphate. Phosphorus is important in the mineralization of bone. Vitamin D regulates blood calcium and is necessary for calcium absorption. Vitamin D is synthesized in the skin upon exposure to UV light, but those living above the 37th parallel in this gray area will not receive enough sun exposure during the winter months to synthesize vitamin D. Vitamin D is not abundant in food, but sources include fish, fortified dairy, and irradiated mushrooms. Remember, when calcium is absorbed into the bloodstream, it needs some direction on where to go. This is why vitamin K2 is important. The main function of vitamin K2 is to activate the proteins osteocalcin and MGP. Osteocalcin attracts calcium into bone, while MGP takes calcium out of the soft tissue. Food sources of vitamin K2 are not what you'd expect and consist of pasture, which means grass-fed, cheese, egg yolks, butter, and liver. High sodium can increase bone resorption. Luckily, potassium can mitigate this effect. Magnesium influences bone mineralization, and zinc stimulates osteoblast and collagen synthesis. High protein intakes are associated with increased urinary calcium, but this doesn't appear to always translate to weaker bones. Adequate protein intakes are associated with lower fracture rates and greater bone mineral density.